There are several things that you need to think about. So first, the question of how long are they going to live? You know, if someone's up, walking, engaging, and they're doing well, we don't think about hospice at all. If they have cancer and, you know, the tumor is a certain size and that people with that size tumor often only live 6 months or so, that's when you think about enrolling someone in hospice. And actually, decades ago when hospice was started, it was started mainly for people with cancer, and you could kind of predict pretty closely how long they would live. It's gotten more complicated as it's moved into the general public, and for those with heart failure, emphysema, dementia, those are more complicated. Those are all very common reasons, you know, that I don't have to tell you that we're all going to die. And mainly, most people, and particularly now, don't want to die in the hospital. Families can't be there. And, you know, it's a very sterile environment. And yes, if someone is acutely ill, particularly with COVID, you know, if they're really uncomfortable, if they're not expected to die, but then things turn for the worse and they, you know, look like they're not going to make it, they should be in the hospital. That's different than for a lot of elders who they've got heart failure and they got more shorter breath, their function is declining, they often are in and out of the emergency room more often, they can't do as much at home, they need to have oxygen. That's when you want to think about hospice. Emphysema is fairly similar. That also can have ups and downs, that elders can end up in the hospital, but it happens more often. They don't have as many good days. They might have to be on oxygen. Those are indications to think about hospice.